Thank you for joining us once again to another episode of Becca's Talking. The podcast comes out every Tuesday, 10 a.m., a brand new podcast where we interview interesting people with different topics and, just people you might not be able to meet in your everyday life. And I think today is a perfect example of one of these interviews, and we'll get to Dr. Bill Lydiatt in a second. But first, I got to talk to you about my friends at Havana Garage. Havana Garage in the Old Market. You know, they've been a sponsor of this program now for a while, and I really do appreciate that. And I appreciate the fact that, boy, that's a great place to go to just relax, have a cocktail, have a cigar, even if you're not a cigar smoker, to just be able to go and sit back and, you know, enjoy the atmosphere, the Rat Pack. That's Rat Pack. That's the word I was looking for. The Rat Pack atmosphere, but the great selection of whiskeys and mixed drinks and non-alcoholic beverages too, if you're so inclined. But make it a point to stop on by Havana Garage if you're going to a concert out at the CHI Center, maybe a play out at the Orpheum, something at the Holland. Yeah, a lot of things going on. Maybe just a nice meal downtown. Make Havana Garage part of your time as you go and enjoy all that Omaha has to offer. So, as I talked about, we meet interesting people and talk to interesting people with a wide variety of topics here. Today is one that is sort of near and dear to my heart. I believe that one of the things that we really have a problem with in Nebraska, but not only in Nebraska, but nationwide, is mental health. The stigma of mental health, the availability to get help for mental health. I've got a few statistics here I want to read before I get to this. Almost 1 in 5 Nebraskans have mental health problems. When I saw that statistic, I was shocked. Nebraska ranks 41st with adults having access to mental health care. 88 of Nebraska's 93 counties are mental health deserts. Joining me right now is Dr. Bill Lydiatt with the Clarkson Regional Health Center, where you are trying to do something to help alleviate this problem. Thanks for being here.
Well, it's my pleasure. I love talking about this because it's an issue that, as you said, it's not only near and dear to our hearts. We know somebody, whether we know it or not, we know somebody that's suffering from mental illness. And we see this all the time. As you pointed out in those statistics, it's a major issue across Nebraska and the United States. And so our goal is really to think about how can we improve access to mental health. And that's what Clarkson Regional Health Services is looking to do, is improve access to high-value care. And one of the ways that we want to do that is by teaching or kind of bringing the game of those that are already out there working hard, that is the primary care physicians, the APPs that are working in clinics all across the state, and specialty physicians, and another kind of unique group, recently retired physicians. So all of those are people that have what we call the therapeutic alliance. They know how to take care of people. They know how to talk to people about really important issues. But they may not feel confident in their own abilities to manage mental health. As I went through medical school, we got very little training in mental health. We got some with psychiatry and some, at different points of our first or second year, but not very much. And then as a resident, I didn't learn much. I am a surgeon, and we focused on doing operations and figuring out how to manage people surgically.
So this brings up an interesting question for me, okay? I know that, let's say, if I go in for a test, if I go in for a CAT scan, let's say, right? That person that does the CAT scan can't tell me what they see, right? No, it's like tomorrow, meet with the doctor, he'll talk to you, or she'll talk to you. But it's, that person that does the CAT scan, nothing, right? So I've got a mental health problem. I'm there in the hospital. The nurse sees I have a mental health problem, or, the assistant, whoever. What can they do? If they're not a trained psychologist or psychiatrist, can they actually act on that, or what happens?
No, that's a really good point. I mean, and I think you're kind of hitting on the multiple levels of access to mental health care that we could have and we could improve on. But the reality is they're not trained to deal with mental health issues. And so you won't have any specific access in those areas. Where we want to improve the access is, again, the touch points that we know patients are coming to. That is the primary care doctors, the specialty physicians, the APPs. But, you bring up a point about what about school teachers? What about social workers are already trained. So they have actually some expertise in that. But what about the techs in the CT scanner or the ultrasound that are doing these exams? Now, we haven't gone that far down the list, but we are, and by that I mean, away from kind of what they're used to doing. But we're very interested in exploring these areas so that access becomes easier. Because even if they can just have a touch point with you to say, Tom, I think you need to see someone about your anxiety. You're obviously very worried about something, or you look very depressed, or you've put on our sheet here that you are thinking about harming yourself or something like that. So I think you're absolutely right. Getting those touch points, education about what the next step should be.
So would they be able to actually maybe just refer you to somebody else then? Is that what you're saying? So they understand these touch points are. Well, let's get to the definition here. What is mental health problem? What is, a mental health disorder? Because you mentioned anxiety in that. You and I were talking beforehand, and, I had some major surgery this past year. And I was anxious about it, and I had all these questions in my head. And while the doctors were very good, I found more support from a closed Facebook group of people that are going through the same thing. And I would ask a question, they would say, yeah, here's what I did, here's how I felt, and they would, help me out, and, and I would help them out. I got more from that than I got, and no disrespect to the doctors and nurses I had, because they were great, but nothing to deal with, like, all the other internal things I was going through.
Yeah, I mean, so it's a huge question. So let me kind of attack it a couple different ways. One is, what is mental illness? Well, mental illness is basically when you have the most common ones are depression, anxiety, ADHD, substance abuse disorder. Those are kind of the big ones. Then there's schizophrenia and some of the other more complicated ones, bipolar disease. Those are ones that probably psychiatry is going to manage in the main. But the depression, anxiety, substance abuse, those are actually being managed primarily by primary care doctors and to some degree other specialists. So when they're interfering with your life, when, we all have anxiety. That's, we're in the whatever, when you're anxious about driving or whatever, there are times when you're anxious. There are also times when you're sad or even depressed in terms of having that depressed mood and, feeling badly but it doesn't last in the normal variant and it doesn't incapacitate you. And those are the things where I think you really want to lock in. If you're having that incapacitation or it's time after time, week after week, those are times when that's more than just sadness or more than just anxiousness.
When do you know it's a problem then? Because look, obviously everybody goes through depression, everybody goes through anxiety, but for the most part you get over it. I know the times that I've gone, like, really had been anxious or depressed, work out a little bit, change my diet, maybe get a little bit more sleep, move on. I get over it. How do you know when it's at that point where it's like, I can't deal with this anymore, I need help?
Well, so first of all, you were getting help by yourself. You were doing things, and maybe you were getting it from other, sources too.
Yeah,
but
read other,
all those things, sleep, huge factor in mental illness. That helps you to decrease the severity of symptoms if you get better sleep, and it can also make you, more prone. Diet, exercise. Exercise is known to be a good, alleviator of depression and anxiety. So you did some things. The bigger question, I think, is, that people think of is, when do I need medication or when do I need a therapist? And I think those are when, again, you're not able to combat it with the methods that you're using, or you don't have the resources. 3, if you're missing work, if you're, like any other illness, if you're perpetually missing work or you're or even a thing called presenteeism, where you're at work and you're just not there. Those are times where you have to be considering what else is going on here, and I need to get some help. And then finally, as far as whether it's therapy or medication, for mild to moderate disease, they're both effective. And that's something that you would need to get a specialist that is a primary care doctor, APP, or somebody to help you to take the next steps.
There is a stigma to this, though. So I may be dealing with this, and I may think that I need help, but afraid to ask, afraid to reach out. And I'm using me as an example here, but anybody else, they go, I don't want people to think that I'm crazy. I know of situations where, let's say like a pilot, if they go and get help, they're going to lose their license or at least have it suspended for a while.
Exactly.
Same thing like with police and fire office. They've got a real stigma with that, and they probably deal with some of the worst instances of having to deal with the trauma that they see. How do we get over that, or can we get over that?
Yes. We can get over it. We've actually made I think, some improvements. If you think about generationally, the millennial and Gen Z, much more open to talking about mental illness and seeking help. So I think they're much more able to destigmatize it. I think our generation is, we see ourselves as, that's a weakness. I should be able to pull myself up by my own bootstraps. And the reality is, the way I try and frame it for people is, because they'll say, "Oh, depression's natural," and I want to use natural remedies to get over it. And I'd say pneumonia is natural. Why would you want to die from it when you could take an antibiotic?
Right.
Or why would you want to be miserable from it and cause long-term damage? Why not get help? We can get help. So I think that's one thing. I'm going to back up for kind of a big picture thing here, and that is, we look at mental health and physical health differently, and there really isn't anything different about them in terms of, for example, you think of, well, a physical exam. If I cut myself, I can see it. A doctor can see it. We know it's there, and it hurts. Well, who's telling you it hurts? I'm telling you it hurts. Right. Mental illness, or let's say anxiety, I'm shaking, I'm hyperventilating, I'm closed up. Those are things I can see. So that's a sign as well as a symptom. And you can say, I'm anxious, I can't sleep, those things. So the reality is there isn't any difference. It's just how we've framed it over history, partially because we haven't had good treatments for a mental illness. And now we have much better therapies over the course of the last half century.
Okay, I'll give you a couple of personal examples here, okay? You mentioned the generational thing.
Mm-hmm.
Years ago, I was able to interview a gentleman who had fought in Afghanistan and was getting over his PTSD. And he had gotten over it. He was, going through treatment and everything. He was doing quite well for himself. And we talked about it. Quite honestly, this is the first time I really had any knowledge of PTSD. I didn't know what it was, right? And so we're having this conversation and everything. And after the interview, I asked him, I said, my dad fought in World War II. He was a past commander of the American Legion Post No. 1. He was always wondering why he could not get soldiers of your generation to join the Legion. And my dad, my dad, enjoyed going down and having a beer with the buddies down there at the bar, and and complain about how bad the food was or whatever, But anyway, so the point being, the guy, the younger soldier said to me, he said, "Well, because my generation goes and gets help, whereas your dad's generation, they would go to the Legion or the VFW, and just hang out with others and not talk about it at all," which is interesting because my dad never talked about his service. It was until after he passed away that I found out he actually fought in the Battle of the Bulge. But if you ever asked him what he did, he was just a cook. Don't worry about it. But I did, so in hindsight, and of course I didn't realize this maybe until I was in my 50s. In hindsight, my dad was dealing with PTSD. But there was no way that I knew anything about it, or probably that he knew anything about it, because it wasn't discussed. It wasn't something that that folks talked about.
Great point. And, you mentioned the firemen and the policemen. To think that some of them don't experience PTSD is just crazy. Because
I can't imagine.
And they think about it, the trauma they see, and they actually experience it. I had a patient who had also had head and neck cancer. So he fought in Afghanistan and then had PTSD. And then when he went through treatment, some 15 years or so later, he experienced it again. He had the same flashbacks, because as you're getting radiation, you have a sensation of being trapped. It's very unpredictable what's going to happen to you, and you get this very anxious feeling. And he said it was exactly the same as being in combat. And so I think that your point about, you mentioned cancer and cancer therapy, and so we actually have done a research project where we did a randomized trial where we gave an antidepressant to people that were going to go through radiation and surgery for head and neck cancer, and then gave another group a placebo. It was a randomized trial. So, and we found substantial reduction in depression and substantial improvement in quality of life in the group that got the drug ahead of time. And then you do it for 16 weeks and then you stop. And they did far better having that prophylaxis in terms of prevention of depression. And so it is, and that's the interesting thing, is there are things we could do and we can do if we know you're going to undergo a trauma.
Now, I want to get more into this in a minute or two. Talk about what you're doing as you're teaching doctors and nurses and other care professionals about how to deal with this. What can the average person do, though? Because the people listening to this podcast right now, for the most part, are not going to be the doctors and nurses that you're talking about. They're going to be just everyday people that are saying, okay, what can I do for myself? What can I do for my spouse? What can I do for my friend? What can I do for, or what should I do? Or is there anything I can do? When seeing somebody go through substance abuse, seeing somebody go through, I've been to 2 funerals this year of friends of mine whose family members, not my friends, but my family members, died from alcoholism. Mm-hmm. And I know that they all tried everything they could to get these people the help they needed. They went to rehab, they went to all of that and just couldn't get over it. What would you? How does the average person deal with that? The person just on the street, that is trying to make life better for themselves and for their family member or friend.
Well, that's a really difficult question to
answer. I didn't expect it to be one of the I wasn't expecting an easy answer.
To be fair, I'm a surgeon, although I'm trying to improve my skills in mental health. I'm certainly no psychiatrist or anything, and I don't want to speak about substance abuse, especially in those difficult cases. They are complicated and they require professional help, of which I cannot give. However, what I can tell you is that there are things that we can all do for both our own mental health and for others, our loved ones, our friends, and that is community. It's funny you bring up the VFW. I think that was actually therapeutic for those guys. They actually were seeking therapy in being together and having that sense of shared purpose and shared experience. And one of the things that we see now, of course, is the phones and we isolate and we, no offense, but we listen to podcasts instead of talking to people. And this is far better, is that person-to-person contact. And those are things that we can do. We can go out and gain one more friend. We can. There was a fascinating study at Stanford where they asked a bunch of students, would you help another student who is having trouble? Well, like 85, 90% said, we would help. And then they asked, would another student help you? And they said, maybe 45, 50% said yes. So what they're saying is they would help someone, but they don't think others would. But the reality is most people will. And I think that's something we don't take into account, is that people do want to talk. I mean, what you're doing here, this is interesting and fun for both of us. I mean, we get to share ideas and learn from each other. Spending time together is a big part of improving not only depression, which it certainly can, and loneliness, but also even anxiety. And then you've already mentioned the big ones: get more sleep, balance your diet, and get more exercise.
You talked about this. I love doing this. Because I get to meet so many different people that I wouldn't have a chance to necessarily meet in just your day-to-day living, because you tend to hang out with the same group of people, whether it be your church group, whether it be your neighborhood, whether it be your occupation, whatever. You tend to hang out with the same group of people, and by doing this and meeting folks that I might not get to know otherwise, it's been a real blessing for me, and I enjoy doing this. And I think that's one thing too, that I know that right now there's a big issue about people that are still working from home coming back into the office. I think there are therapeutic benefits to coming back into the office. I myself basically do most of my work from home, all right? But what I do is I go in the morning, I will take my laptop down to the Panera just to be around people while I'm doing my work. And sometimes I'll come here to the station and just do some work here just to be around people, because you do need that, that human connection.
Exactly. You're not alone.
Yeah.
Just having that, and just being able to talk to the people at the, as you're ordering food, or somebody that's sitting next to you. I couldn't agree more. Those are really important tools. And I think that's something we actually have to reteach many of our younger, our Gen Zers and millennials to some extent, because, the phone has taken the place of a lot of those kinds of events, and it's harmful, and we know it's harmful in terms of increasing loneliness. So I think you're right.
One other question here on this regard, which I just thought of, which again may not have an answer to, but we've noticed how we've become so politicized.
I hadn't noticed.
Yeah, you haven't noticed that? You really need to get out more, doctor. Turn on the news. But that's it. So, it's like, I really used to like Charlie, but now he voted for such and such, so therefore I really can't be friends with him anymore. There's all sorts of instances like this. How do you get over that? How do you deal with that? Or can you? Because it takes two to tango. If that person doesn't want to be friends with you anymore, then how do you do that? But is there a trick or something like that, or you just sort of?
I think again, I'd reflect back on what I said about the fact that we have a perception of others, and we have a perception of what they perceive us, and usually we're way more cynical as a group than the reality. So I think part of it is we think they won't want to be friends with us because, and so I think that's one, is that we're probably overreacting. You're absolutely right. In a way, politics has become religion, and it's much more deep-seated, and it's much more of a tribalist kind of approach both ways.
Yeah.
It's not one or the other; it's both. So to me, it comes back to small groups, because again, the evidence is pretty clear. If we get together in small groups, if we have two clashing, protesters, nobody's going to get anything other than a broken bat or something.
Yeah.
But if you get one or two together and talk about, not necessarily go for the third rail issue, whatever that happens to be, but other peripheral issues, the reality is we actually do agree on most things, and we have similar ways of approaching things. Even big ticket, not to bring these things up, but like immigration. I think most people feel like we need more security at the border, and I think most people feel like immigrants are the best thing that happens to this country. So you can hold both of those truths, and in fact, I think most people do. And if we could just talk about that, you might say, well, no, we need a taller fence, or we need bigger, or I might say, we need to let more people in, or whatever. But we'd be arguing around the fringes rather than arguing against a
And a lot of that is all listening. You talk about it, but it's also listening.
Totally.
And say, okay, well, why do you feel that way? And no, I hadn't thought of it that way before. That sort of. But that's another topic for another day. But but here's the other thing too. From a marketing standpoint, you can't get people all riled up to vote for you if you say, I'd like to have an intelligent discussion about immigration.
Right.
You get them chanting "Build the Wall,"
Right.
or you get them, saying, you're separating the children from the families. You get that emotional thing to get people all riled up. You can't have a serious conversation. Matter of fact, if you take a look at this last election, so little was discussed about policies. It was all about emotions and what bathroom somebody uses. But that's another topic for another day. I want to get to what you're doing over in Clarkson now. We'll get to that in a second. But I want to mention one more time that this, of course, is brought to you by the folks right there, Havana Garage in the Old Market. The folks there they're just good people. It's just a nice place to go, relax, unwind, have a conversation with your friends, maybe after work. Stop down there. You talk about getting together with people.
Exactly.
There's a lot to be said for that, just to go and maybe start up a conversation with some stranger at the bar. Learn about them. Find out what's up in their world. There's a lot of good things can happen when you go and take some time and relax and unwind at Havana Garage in the Old Market. Okay, so as of now, by the time this is released, you will be the president of Clarkson,
CEO, yeah.
The CEO of Clarkson Regional Health, which, like you say, you've been a surgeon your whole life. Now you're going to be an administrator, right? And this is if you're going to be an administrator, why is this like your first issue, your main issue that you're trying to get through to people?
Oh, that's a great question. So, the reason is, so we actually have my friend of mine, John Mitchell, and I actually at breakfast, with other guys, we got together and we talk every Saturday. And one of the things we talked about is how we can give back to the community. And so we did some research. We invited some different folks to learn about the issues, and mental health rose to the top as the biggest issue that we face in terms of something that we, particularly as a group of physicians, could potentially do something about. And so over time, we landed with help and insight from people like Rhonda Hawks and Howard Liu. We came to the conclusion that this is something we can do, and we can actually tap into an existing workforce to expand the workforce and catch more people so that we can get them diagnosed and begin treatment. That's why we wanted to focus at Clarkson, because this is a group. It's a very old charity. It actually started by Bishop and Clarkson and his wife back in the almost the middle to latter half of the 1800s, 19th century, and they wanted to improve the community. And the reality is, that's what we're trying to do as well. So the mission really hasn't changed. It's just, and they had a focus on women and children, and we also do as well. So we're really focusing on how can we improve access to high-value care that would be, particularly in mental health and in women and infants. And so that's why we focused on mental health. Again, as physicians, we wanted to stay in our lane. It was something we at least had some understanding of, which is health care. And that's also what Clarkson has focused on, is how can it help Nebraska health care.
Now, I should know this, but I don't. Somebody who's lived in Omaha a long time, what is now Nebraska Medicine used to be Clarkson, right? That was Clarkson Hospital. We're going to Clarkson Hospital. Okay. Then it became, as far as my awareness, is like a nursing school pretty much across from Nebraska Medicine. What is Clarkson Regional Health?
Regional Health Services?
Yeah.
Well, it's a very good question. So, and you're not alone. I mean, in fact, I would venture to say that most long-term Omahans don't know what Clarkson Regional Health Services is, and they confuse it with Clarkson College, which is also an excellent, started by the same couple, back in the 19th century, again to help improve their community. And then Clarkson Hospital. So Clarkson Hospital is really that was the hospital that the bishop started, became that. It was a very innovative hospital. They had a foundation, and that's really what we have as our corpus, is the foundation of that hospital. Through a number of things that are too complicated and, frankly, for me to even explain, over time, Clarkson Regional Health Services came to be, and Nebraska Medicine was kind of a joint effort by Clarkson Hospital and UNMC, or University of Nebraska. And so it's dually owned, basically. Clarkson owns half of Nebraska Medicine. So and so it's that is a different entity. And then Clarkson Regional Health Services is really starting off as a charity, kind of, you think of it like a foundation.
Oh, so this is new.
It's an old organization with a new mission and new purpose.
All right, cool. So, and you're going to be holding like seminars now. But this is going to run in forever. So you can't really mention like, we're doing something this Thursday. But you're going to be holding seminars for doctors and nurses and first responders, I would imagine, too. And
we're having so it's primarily physicians and APPs, but we've also had a number of other people come, and we definitely would welcome. It does have a medication bent, so it's about prescribing. So, but there's also cognitive behavioral therapy and other therapy techniques. So there, and just the general awareness. The people that do it are fantastic educators. They're Harvard professors, two of them, and one of them is a chairman at the University of Vermont in psychiatry. So they're psychiatrists, and they do this great 2-day seminar that you get CME, continuing medical education credit. But we've held 5 of them now. We've trained over 220 people. And we're actually having another one, and I know, this will but January 16th and 17th at Joslin, so at the museum. We're going to hold it there.
How's the response been? Do you find when you say we're holding one of these seminars, sign up now, are people saying, oh, I've been looking for something like this? Or is it like, well, okay, well, it's an hour of continuing education, so I'll sign up? What's been the response from the people? Are they open to it? Do they want to learn more about this?
The thing that has so we actually started this as an experiment because we didn't know whether anybody would sign up or not. You have to take 2 days off work to come to this, so it's a big deal. We were pleasantly surprised. The first cohort that went through, about 22 people, and we got a lot of feedback from them. And then we did it again. We got twice as many. We held it at Clarkson College, which, just to complete that statement, Clarkson College is a wonderful. In full disclosure, I'm a board member of Clarkson College also, but it's an independent. College that does lots of different things. They train, lots of different medical professionals. So nursing is kind of the hallmark, but they do nurse anesthesia. They do, a number of other really good programs there. So it's a great school. It's affiliated with Nebraska Medicine. That's where a lot of their sites are, where they train. So, and they have a great relationship with that. So, so we held it there, in their space one time. And then we've gone to Lincoln, we've gone to Kearney, and then we're back in Omaha this time. And we've had incredibly enthusiastic responses. People have been, they've really given us, I mean, the presenters, 5 stars. It's been really well received.
I believe that there's not a 100% solution to the mental health crisis, but there's a 101% solution. So every little thing that you can do to help move the ball forward, because you take a look at so many of our societal problems, homelessness, drug and alcohol abuse, violence, domestic violence, so many of our suicide and all that, so many of our domestic problems could be at least alleviated somewhat. I'm not going to say cured, but but at least made better if we had a better attitude towards mental health and also had better access to what people needed to get the help, that they wanted, Although I have interviewed in the past, I've interviewed homeless people on the street corner. I've interviewed them, and I found that some of them just like living like that, which of course is completely beyond me. But it's just like, yeah, you know what? Yeah, I don't have to answer to a boss. I don't have to go to work. I just, I make $50 a day holding up a cardboard sign. I get drunk, and they're happy like that. And I don't, this is beyond me. But other people that are just saying, I don't want to live like this anymore. We need more help for people like that say, I know I'm going down the wrong path. How do I fix this? Because there aren't the facilities. As it said, 88 out of 93 counties in Nebraska are mental health deserts where there's not even a place for them to go. In Douglas County, the number one mental health facility is the county jail. That's just, I will, somebody that I know really well, this past, maybe 7-8 months ago or so, thought that this person was having a serious mental breakdown. Wound up taking him to a manual, and turns out he was having a stroke. He's now in a nursing home. But if he had been a mental health problem, there would have been nowhere to put him. There would have been nowhere for him to go to get the help that he needed if that was a serious psychotic episode. It turns out it was a stroke, and, thankfully he's, physically going to be okay, and, a little bit mentally for the most part, well, that's another story for another day. But at least they had a place to put him. There's no place to put somebody that's going through a serious mental health problem other than the county jail.
Well, yeah, and so we are in Omaha where we do have some beds, but you're right, it's a very low number of beds, and the children's hospital that's being built is going to help that with pediatric patients, and then there's another one being built over in Council Bluffs. So we are getting some more beds for the area, which is good news, but it's still we're way below what is necessary.
Pleasure talking to you. Very interesting. And is there a website? If people want more information on this, is there a website they can go to?
Yeah, so we call our project Bridges to Mental Health, and it's on the ClarksonRegional.com. So Clarkson Regional, one word, .com.
Bridges to Mental Health.
Bridges to Mental Health.
Bridges to Mental Health. Check it out. Thank you very much. This has been brought to you by, of course, the folks at Havana Garage in the Old Market. A great place to go and just sort of relax, unwind, and de-stress a little bit. And like I said, have a conversation with some friends and just sort of, take care of yourself. And not to, we talked about alcohol use and everything. And now I was saying go out and have a drink. But if there is an issue there, then that Havana, they want you to get the help too. So make sure that you take care of yourself. Anyway, take care of yourself. Be well. Till next time, take care and bye, y'all.